Avem domenii de excelență, deci neurochirurgie pediatrică. Avem un profesor care se numește Memetozec, care este președintele Asociației Neurochirurgilor Pediatrici din Europa pentru 2009-2010. Rectorul Universității de Medicină, profesorul doctorul Necmettin Pamir, e un nume mondial, cunoscut mondial în domeniul neurochirurgiei. Chirurgia cardio-vasculară pentru adulți și cea pediatrică ocupă un loc foarte important.
Well, actually, international patients come to this hospital because this hospital have so many facilities. We apply the most recent technologies. We do all kind of interventional and non-interventional therapies in this hospital. We also apply, as I said before, the most recent technologies like robotic surgery, the Da Vinci system. The system consists of three parts. One is the patient console, which has four arms. One of these arms carries the camera. This is inserted into the patient. It's 8 millimeters in diameter, so less than 1 centimeter. And the other two arms, as you see, also have the same port system, which is also 8 millimeter. And we have an additional arm for assisting the system. On the other hand, there is a surgeon console. The surgeon sits here and he has a three-dimensional image, also with the feeling of depth. So he can do the operation as he is in the patient. When I move my hand like this, the system, the arms do the same movements. So when I want to put a stitch like this, I can do it very definitely and very precise. This the computer here transmits all the images to the surgeon console.
Avem foarte mulți pacienți din România care se adresează pentru tratamentul de fertilizare in vitro. Din ce în ce mai mulți. Probabil și prețul competitiv între țările și din România și țările învecinate joacă un rol important pentru a avea decizia să vină la tratament la noi.
In IVF unit we do everything in terms of getting pregnant, which means ovulation induction, IUI, which means intrauterine insemination, and IVF treatment. And we have additional facilities here like fertility preservation in cancer patients. So before they get a cycle of chemotherapy or radiotherapy, they come here and we store their gametes so we can help them produce their kids in the future. A very high chance of pregnancy we see here. We can say that more than 85%.
Se poate spune că spitalul este unic prin prezența în cadrul său a unor tehnologii foarte scumpe care au prezență doar în câteva centre din Europa.
This is the CyberKnife patient lies here. System gets some images. These images are obtained by the two X-ray imagers in the ceiling, and also on the floor we have two image detectors, and system continuously gets images in 45 degrees and controls the movement of the patient. So system automatically arranges the position of the patient so that the accuracy is sub-millimeter, which means less than 1 millimeter. And if patient moves, then robot moves the patient according to the ideal position. And this robot comes here and gives radiation. Treatment time is usually between 15 minutes to up to 1 hour. Sometimes it can be a long treatment. And during treatment, patient doesn't feel anything, does not have any pain or anything else. And after the treatment, there is no problem. He or she can go home. She can go to the movie, cinema, or even she or he can dance. So it's a very comfortable surgery, but there is no blood, there is no incision, there is no pain.
In radiology, the technology is the most important thing. If you have a higher technology, then you can give better results. It's the first one in Turkey. It's a CT device, which is named Flash CT. The advantages of this device is the fastness. You know that radiation is a problem for especially CT procedures, and everybody is concerning about radiation. And with this device, the problem is mostly solved. Of course, it has radiation, but it has a very low dose radiation. This device is especially used for cardiac images.
Luând în considerație condițiile excelente din spital și tehnologia cea mai modernă pe care o folosesc în cadrul Acibademului, medicii de top din Turcia, cei mai talentați medici din Turcia, preferă să lucreze la noi.
This hospital, for ENT, otolaryngology part, for my part, there is no surgical procedure that we cannot do here. Okay, every patient with a difficult problem can be treated here. We both have infrastructure and enough knowledge to do that. Okay, and some rare cases, for example, ear deformities, congenital ear anomalies, airway problems such as congenitally blocked trachea and larynx can be treated here. Those cases can be treated only in a few centers in all over Europe or in the world. Istanbul is one of them. For example, for congenital hearing losses or total sensorineural hearing losses, Romania can cover only a certain amount of patients to be implanted with the cochlear implant. In Turkey, every patient gets the cochlear implant, for example.
Our laboratory is the first accredited lab in Turkey. Some different pharmaceutical companies or diagnostic companies, before launching their new equipments, they make some negotiations with laboratories, and they put their new equipments in those laboratories, and they want those laboratories to test their equipments. Normally we accept around 2,000 samples per day in this laboratory. So we analyze 2 or 3 million tests per year.
International Patient Center is working hand in hand with the local marketing departments and running quite a lot of serious projects with different countries' governments. They do projects that are subsidized by the governments of Iraq or Serbia or Bulgaria and all other different countries. Where they don't have the know-how or technical capabilities or the knowledge about the treatments of some specific injuries. On the other hand, with the Acibadem University's international affiliations and education programs that it runs, not only providing the care here, but also educating people of those countries is possible right now.
Acibadem Healthcare Group is by far the largest healthcare group in Turkey, with more than 10 hospitals, almost 10,000 people working for our group, committed to high quality services. So far we have been a domestic company, yeah. But over the past 5 years we see more and more foreign patients coming, finding us. So we are looking at many different geographies, many different countries.
Actually, we've been looking at the Romanian market for a while. We think that it is posing a lot of opportunities. It is a European country. It's very close to us, 1 hour flight from Istanbul. And we receive a lot of patients from Romania. And Bucharest is an interesting city. We like it a lot. And we are strongly considering a kind of investment in Romania.